We're here and glad you're here today. Thank you for coming. We have, we'll call a roll and then we'll go forward with our meeting of the Community Services Committee.
Ms. Parker?
Present.
Ms. Weber?
Present.
Ms. Polk?
Present.
Mr. Snipes? Ms. Peters? Present. Mr. Tholen? Mr. Carrico? Present. Mr. Kirkstra?
Present.
Mr. Eckhoff?
Present.
Ms. Bryan?
Present.
Ms. Hudson?
Present.
Mr. Smith?
Present.
Mr. Alexander Hildebrand? Mr. Raymond? Mr. Wheeler? Mr. Seroy? We have a quorum.
Thank you. First, we have some public comment. So, Mr. Schreiner, you want to come to the microphone beside you there? Would that be fine?
Number 18.
Number 18. Okay. Let me ask people if they'll look on on your tables is a photo of Mr. Schreiner and some of other of us, and then you want to go ahead and explain why we were together and then what your message is today.
Yes, ma'am. Thank you for inviting me to speak today. My name is James Schreiner. I'm the Drug-Free Communities Grant Project Coordinator for the ICANN Regional Office of Education.
He wanted you to be in the picture as well.
I'm in the picture now. Actually, I have a face for radio, so. I'm the Drug-Free Communities Grant Project Coordinator through the ICANN Regional Office and the Pledge for Life Partnership. I'll just give you a little background. The Pledge for Life Partnership, we've been a community-based organization for 31 years, working on substance abuse prevention in our community, probably most known for our K through 8 substance abuse prevention education curriculum. We have modified mobile units, we call them classrooms on wheels, that we take to schools, of course, pre-COVID. But kids would get on, and we have a unique prevention curriculum that we reach about 10,000 school-age kids per year, teaching them about wise choices and resilience skills and things like that. You might know our mascot, Harold the giraffe. So he's done a lot of work with probably some of your children in schools. Like I say, we've been around for 30 years. So that's the Pledge for Life Partnership. Myself, I'm a retired school teacher. I retired in 2019. And Greg Murphy sort of brought me back into the fold, the superintendent of schools. He said, you need to come work for me. So since that time, I've been doing substance work, prevention work, trying to get the Pledge for Life Partnership in a more virtual world because of COVID, still so that we could spread our message to schools. And finally this year, we're back in schools. However, we're not using our mobile units. The teachers are actually just visiting classrooms now. So we're starting to get back into the thing. So the initiative that I'm working on is trying to reduce the amount of opioids available to our community members through a lockbox initiative. I work closely with John Beavis, who is on our board for the Pledge for Life. And also I'm on the opioid task force, where I work with Bob Gessner, and Bob, John, and I had a conversation, and I was basically trying to hawk money from him to be able to purchase these lock boxes. And he suggested that I write Mr. Wheeler and apply for ARPA funding. And just to make a long story short, one thing led to another, and the board agreed to give the Pledge for Life Partnership a reasonable amount of money to do our work in our community. So just very quickly, the synopsis that I passed out has a little story and all of the, kind of highlights of what our partnership does. But what we're thinking about doing is providing these lock boxes so that people that are in need, because of COVID, we've noticed that there's a high number of prescription being filled these days, and we all know the issues with the opioid epidemic. So locking up your medicines, we're targeting people that have opioids in the home to be able to help them prevent accidental theft, loss, reduction of addiction issues, and also suicide ideation. We know that when issues arrive, some people will reach for the medicine that they shouldn't be taking, so we're trying to make our community as safe as we can. So this is just one of the initiatives that we do. Our coalition, we follow a strategic framework in regards to our prevention efforts. The Drug-Free Communities Grant that I manage allows us to work with 13 sectors within our community. We have police and fire, we have families, schools, a lot of different representatives on our board. And I'm pleased to be able to present to you today because I know quite a few of you are on other boards and are very involved in the community. So if you would ever like me to speak on things, for example, like high potency marijuana, this is one of the issues that we're starting to see. All these kinds of things that are coming around because of recreational sales are obviously skyrocketing in Illinois. So we work with marijuana prevention, alcohol prevention, as well as opioid and other substance abuses. So that's really what we focus on at the Pledge for Life. So I just appreciate your time and being able to present to you. I brought a little care package for you. Inside is some of the things that we do. You'll notice that there's 2 drug disposal pouches inside the bag, which those are really kind of neat. We work with law enforcement, we work with KMEG, and we have 2 drug take-back days per year that we sponsor. Last one was at the end of October. We brought in over 1,000 pounds of unused and unwanted medications. It was a drive-through event at the mall and very successful. Throughout the year, we pass these bags out. All you have to do is just unzip the bag, put your unwanted medications inside, add a little bit of water, seal it up, shake it up, and it's safe to dispose of in the trash. It's green, environmentally friendly, and it'll allow you to get rid of some of the medication that we really don't want having around the home. So I'd be glad to answer any questions that any of you guys might have about our initiative or anything that the Pledge for Life does.
The important thing is that the box locks and the bottles lock.
Yes, ma'am. That's,
So
I'm sorry. So these lock boxes, they have combination locks on top, and they also too will fit on the prescription bottles so that the cap will actually lock as well. So, and this is just one of the samples that have been sent to us. This one here, we're thinking quantity versus quality or quality versus quantity. That's where we're at right now in our planning stage. So we have a few more different samples of these lock boxes being sent to us, and we would love to partner with some area agencies. We've been talking about getting in contact with like Uplifted Care because we know of all the medicines that are in the home during that. So, but if any of you guys would like to reach out and work with me, my business card is in the bag. And there's a little gift in there for you. There's a first aid kit for your car, and there's some brochures in there that describe where the our prescription drug drop boxes are located throughout the community. We also distribute that information in Spanish as well. So we're just very engaged in what we're doing. We're excited to continue our prevention efforts, and we appreciate you taking the time to hear our story. Thank you.
Thank you. And just to bring us back to the committee, what had happened is you filled out the correct forms to apply for the grant, and then the county board granted your $10,000, and that's part of what you're going to use to purchase the boxes. Is that right?
Yes, ma'am.
Okay. So that just brings us back to the good of the community, for the good of the community and the good service to the community. So thank you for all you've brought today and all your information, and hopefully see you soon again.
Thanks for having me.
I'm glad you were here. Thank you. Okay, so what you could have, should have, might have received are the minutes from the October 19th meeting. I have those. You probably have read those. So would someone move that we accept those?
Polk.
Okay, wait a second. I'm going to take Ms. Peters had her hand up first, Ms. Polk second. All in favor of approving the minutes, say aye. Aye. Any opposed, say no. Okay, motion is carried on that. Thank you for all your volunteering. Okay, next we'll turn to the first report. The county clerk, Mr. Hendrickson. Here he is. You've also had a chance, I hope, to look over his report. See if we have any. No, not going to do that this time, I guess. Okay, so if someone will move that we accept that report, Mr. Eckhoff, Ms. Hudson, you want to second it? Okay. Any questions, or what would you tell us before we vote about it?
I don't have a thing, so.
Number 3, sorry.
Number 3. Thank you.
I still don't have a thing.
You know, something I just looked again at. What is the line that says public health, TH state treasurer, death, domestic violence?
Part of the funds that we receive for domestic violence and for marriage license goes to the state. For one of them, the death surcharge goes toward part of our funds for our automation, but there is a domestic violence fund that monies for the marriage licenses go to the state for.
Mm-hmm. That's a good connection, I guess.
Yes.
So, is there another question on his report? Before the meeting, he and I were talking about that coming soon will be a time, and since we would all have an election opportunity, that petitions would petition circulation will begin January 13th.
We will have packets available in the office. We will have them online. And I think the question that Mrs. Weber asked was, can, you know, a person, what defines somebody who's eligible to sign a petition? And the only requirement is that they are currently a registered voter in the district in which you reside. So previous party affiliation does not make a difference. So if somebody was party A for their whole life and now they decide, heck, I want to support a candidate that's from party B, they can sign that petition without any problem. The issue comes when somebody's signing a petition. You can't sign a petition for party A and then also sign a petition for party B during that nomination period. Or in Kankakee County, there's also Party C as well. So
yes.
y'all figure out which one is which.
Is there an ending to that January 13th? Is there an ending to the file? Would
be the last day. I mean, the last day to circulate is the last day to file. So anybody who's a procrastinator, you can actually circulate on the last day for filing, as long as you get it to our office by 5 o'clock that evening.
Which is? Oh, I'm sorry, but it's later than that.
Yes, yes, it will be in March. Oh. I don't hold me to the date, but it will be mid-end of March. I can have those dates again for you at the next meeting, next community services meeting. Yeah,
so that's good for us all to know that there are.
But that will be part of the packet that's provided to you. Will be the dates for filing.
Mm-hmm. Yeah, and then I think it's important to have registered voters on your petition. That's for sure. So.
Well, it's critical that you have registered voters on your.
Yes. Okay. Last thing, unless someone else has, is how did you like our visit last month when you showed it worked out?
Well, you know, I went back to the time when my predecessor Bruce Clerk and I we did a demonstration of the equipment that we bought. And dating myself, it was at the Redwood Inn for a committee, and sure enough, you know, we did the demonstration, and the ballots wouldn't go in the reader.
Oh,
so
I wondered why.
After everybody had left, we figured out what the issue was, and it's like, well, come on back. So yeah, we my chief deputy Lori said, well, why didn't you put any ballots in the bin when we demonstrated last month? Well, it wasn't taking it right. She said, well, did you unplug the printer was ajar. She said if you'd just closed that, it would have been fine.
Oh.
Yeah. So we were able to get it to work, and it works fine now. And if anybody would like to see a properly working demonstration of it, we can accommodate you. So.
Well, and just a few weeks or months ago, he was at the Women of the Moose with Lori, and they were totally impressed with that new equipment.
It worked then, didn't it?
And in 2 months, he'll be talking to a group of teachers in February, so he is on the road.
Yes. And anybody else who would like a demonstration, please let us know. We'll be happy to hit the road.
But now with the purchase at our last meeting of your holder, the things for the, then you should be all complete with equipment, do you think?
Yes. We've been notified that we will be receiving our ballot boxes in December, and the optical scan voting equipment in January. We should be all set for the June primary.
Well, that's good. Okay, sounds good, doesn't it? Do you feel good about that?
Yeah. Absolutely.
Anything else? Mr. Eckhoff, let me find your 9.
Yeah.
Thank
you, Madam Chairman. The deadline is March 7th and 14th is the last days for signatures. I just saw that.
You're trying to take my job, aren't you?
No.
What did you say, March
7th to the 14th.
Oh, 7th to the 14th is the filing date?
Yeah.
Oh, 13th is when you can start circulating.
Thank you.
March is when you bring it. So you have that long period of time to bring back how many signatures you have. So thank you very much for checking that. I think you really have a good report now.
Yeah.
All right, thank you so much.
Oh, you're very welcome. Y'all have a great day.
You too,
And
please.
happy Thanksgiving to you.
Thank you.
too.
Oh, did we vote on your report?
No.
No.
Second.
Okay, we had a first and second and a discussion. So all in favor of accepting that report, say aye.
Aye.
Any opposed,
Aye.
say no. That motion carries. It's going to be. Mr. Blair will come next. As you see his report, we will move in second and hear it and then vote on it afterwards. So will someone move that we accept that report?
Polk.
Ms. Polk, Mr. Snipes will second it. Mr. Blair will give it. We have,
Got a second yesterday. I'm good. Oh, there you go.
Morning.
I'm so sorry.
Morning.
Good morning.
Good morning.
Morning.
Well, off the top of my report, I just wanted to let everybody know last month I had a pretty good idea of how many appeals we had taken, but we could still get some things in the mail. I knew at that point we took 244 appeals this year as compared to last year at 280, so down a little bit, but still a pretty stable number. Just kind of wanted to let the committee know that 244 this year. So as far as some things that we are getting done or have gotten done today, throughout this past month, we've received all the township assessor responses on all the appeals. The township assessors do provide responses to the appeals so that the Board of Review has both sides to look at, what the appellant feels the property is worth and the evidence there, and then the assessor provides some evidence either to support that if they agree with the appellant, or reasons why the value might be, you know, what it was set at when we published the value in September. Things that are happening actually right now as we speak: tentative decisions on all Board of Review appeals are being issued today, which will allow us to schedule the last day for all of the final hearings, which I believe is going to be December 21st, would be the last day for any final hearings on the Board of Review for any appeals that were filed. Some things that are coming up: we have, obviously we have the Board of Review hearings. Those are typically happening every Tuesday, starting at 8:45, and just depending on how heavy the day is, it could be, like today was just 8:45 and 9 o'clock, but it could be going all the way to lunchtime, and sometimes it'll even go into the afternoon if we have a really heavy day. So it just depends on how many appeals we have to hear that day. Then once the the hearings are over, I'll have to decide whether or not there's any equalization necessary at the Board of Review level. Typically, that does not happen, but, you know, I do need to be aware and issue any equalization if necessary. Once that's done, then I can deliver the final abstract to the county clerk, which typically I'm able to do by the end of the year, and it looks like we're tracking that way again this year. I should be able to deliver the final abstract to the county clerk by the end of the year, and then the clerk would then send it into the Department of Revenue. Revenue will have their typical questions that they normally have, and then they will certify it back to the clerk. The final abstract, certify it back to the clerk so that they can begin extension when they're ready in the spring. So with that, I'll open it up to any questions.
Is there a question? Would you say that 244 hearings are held then?
No, it's hearings are only held if the person disagrees with the tentative decision that's issued. So we don't, I mean, there are 244 tentative decisions issued, but as far as hearings, it's only those that disagree with that tentative decision that would show up in person to state their case in front of the Board of Review.
Is it 50%?
It's probably more like out of the 244, we might get, you know, 60-second hearings, something like a quarter.
A quarter. And
Might
then
show up because they've got to take time off of work and, you know, things like that, and you know, many times the assessors are able to work things out with the appellant before it gets to that level to where they need a second hearing. So there's a combination of reasons why you don't have 244 second hearings.
good reasons then.
Good reasons, yeah.
Yes.
Could be good reasons, yes, absolutely.
At the ones at the hearing, you must come to a decision. It can't be, well, we'll think about it longer. They don't go to a second hearing, right? You decide at that hearing what's going to happen.
Right. The final hearing is final for the local level. If you're unhappy with your local decision, then you have the right to go to the Property Tax Appeal Board, which is a state level body, and you know it'll take a little time. It'll take a couple years for them to get to your case, but eventually they will rule on it. But the Board of Review's action is finished once you have a final hearing.
And you wish to be amicable, right? You wish the two parties to come to a good decision.
Where possible. It doesn't always happen. You know, sometimes each side is, you know, too far apart to reach an agreement. But where an agreement can be reached, I think it's a good thing to do as well.
Yeah. Most common appeal is on value. Increased value?
That's the most common way it is. Yeah, you know, increased value. Sometimes though, if a value wasn't changed, a taxpayer may still feel like it's too high for the current year, and they still have the right to. Every property has the right to be appealed every year. So whether it was increased, decreased, or stayed the same, it can be appealed.
The other part, looking on the third page of your report, is $7,089.92. That's publications, isn't it?
Are you talking about on the second line there?
Yeah, it's community service report for fee reimbursement postage.
Right, that would be the township assessors do reimburse us for the postage on any of the assessment change notices that we sent out for their township. So those are the reimbursements that we've gotten to this point from the townships.
So that isn't all those pages of advertising. This is an income rather than an outgo, is that right? This is an income?
We front the postage and then they reimburse us for it.
Okay, all right. So, okay. Mr. Snipes.
Thank you, Madam Chairman. If they, for some reason, after the final reviews, they also have an opportunity, if they still don't agree, to petition the court in a limited scope for judicial review. Do they not in this process?
Yeah, I believe there is a way that you can typically what happens is you either go to PTAB, Property Tax Appeal Board, or you can pay your taxes under protest, which really involves more than just my office. But you can go to circuit court and pay your taxes under protest, but you still have to pay the taxes first and then bring your case forward as to what, law was broken or what was wrong with your case where you feel like you need to be remedied through the court.
Is that what you were asking?
Yeah, the part of judicial review, which is then just another avenue of things.
Another level.
Right.
Thank you. Okay. If no other discussion, all in favor of accepting that report, say aye. Any opposed? Say no. Motion carried. Thank you very much for your report.
Happy Thanksgiving, everyone.
Happy Thanksgiving to you.
Ms. Gadboy is unable to be here today, but we have her report, and she would be smiling if she were here, wouldn't she? Because $236,089.99 is the next highest except for December 2020. So do you remember last month that she told us that there was a big sale in going on and that we would see a big number? So if you look across the numbers listed for October in state stamps, $92,000. So that's one of the numbers she usually points out to us. So very, very, very nice. And she would say things are happening well in the county, $236,000. So, yeah. Okay. Let's have a motion to accept that report. Mr. Eckhoff, Mr. Kirkster seconded it. All in favor say aye. Aye. Any opposed? Say no. Motion carried. Thank you for that. Okay. So we'll have next turn to Ms. Laird for the animal control. We can turn to those pages. And it only, what it implies cleanly is that you're busy.
Yes.
Yes. So we'll have a motion to accept the animal control report. It's 2 pages. Mr. Carrico and Ms. Bryan seconded. So let's take a look. What would you highlight? And then we'll ask you some questions.
IPTIP. So last year was over $400,000. Last month, over $400,000. We used some of that money to purchase a van, so that's why it went down a little bit this month. So as you can see on the bottom, we now have a 5th vehicle, a 2021 Ford Transit van that is being worked on at Kankakee Truck. They are outfitting it for animal control purposes.
So you still have 5 vehicles at this point?
At this time, yes, yes, because one is being worked on, the other one's still in the fleet.
Okay. And so you also have given us the mileage on those 2.
Yeah, this one I don't have because it's not at our facility right now. So yeah, it's not in use yet at this point. So there's no mileage on it. I think it had less than 1,000 miles on it. So.
But they all are usable still.
As of right now, yes.
And equipped.
Yes.
Yep. Okay. So tell me that. Wait, let's go back. Sure. Where was the ITIP number you were referring to up at the top?
So the ITIP, $372,000 for yearly total to date. I think last month it was $416. It was around $45,000 for the van.
Okay. But contrast it to last year's 263 shows, 110,000 more. Correct. Even with that out.
And I have talked to the sheriff, and I'm going to talk to the treasurer. I have money in a checking account that I need to transfer to IPTIP as well. The money that we made revenue over expenses last year that I need to transfer to IPTIP. So it's around $100,000.
And what your department has had permission to look for a building, is that
correct? So we have been looking. We have one in mind. We're just in the process of trying to figure out how we can purchase it, if we can purchase it, what the price is. We don't want to give any details because we don't want to give anything further if somebody else wants to jump in and take anything from us, because we have a perfect place. So
that's the good news. Please go ahead.
Just an FYI, it's contained within the potential animal control building, build out, all the other things associated are contained within the RFQ that the committees will see, building and grounds, and then the board, because we've got to put prices behind all of the building projects so we can budget and see what we have money for and what we don't.
But that's good to be it's in the parade, it's in the line for the parade.
There could be an end soon.
Yeah, so. It hasn't been there yet. It has never been at that place.
Right, so I'm hoping that, we get that soon. Village revenue, as you can see, is a little bit lower, but I've been hesitant to do contract with larger municipalities only because our totals inventory of animals has been very big this year.
Without any more
exactly. And not that we don't go on the calls, because we do. Majority of the pit bulls that we get are from the city of Kankakee, and it takes a toll on our facility, on our resources, on the shelter staff. that we have all these pit bulls. 2/3 of our population right now is pit bulls, and that's a good and a bad thing. We don't have everybody who wants pit bull, but we have pity rescues that will take them from us. So it's good and bad. But yeah, our village revenue has gone down, but our animal intake has gone up.
Yes. So let's, looking at inventory, I guess that's what taxes your facilities, is that inventory. So would you, let's see what the current inventory is. It 17 dogs? Are there 17 dogs?
There was, at the end of the month, there was 26 dogs and 4 cats. So I want to say there's around 20 of each right now.
And you're bulging probably. Or you're...
We had 29 at one time, which was very, very high, 29 dogs, which was a very, very taxing situation on all of our staff to try and find places for these animals, to take them out in shifts, to feed them, because not everybody gets along with everybody else. I was talking to Miss Bryant earlier about adoptions. So my philosophy when it came into animal control was to not do adoptions. It's to get them to rescue. So we hold them on their stray hold and we put them out for rescue. So that was successful in 2020, 2021. The first half of it was successful as well. The second half has gone downhill. So our population is rising. Rescue had been taking our animals, but they have been slow to do it. So although we don't have any animals up for adoption, if you call and you're the right person for the right animal, we might have one for you. So that's where we are this time.
It's not what your sign is about. No, you're not in that business necessarily, but you surely, if a pet can find a place to stay home forever, that you would be glad to do that. And so the pet would love that too. Mr. Snipes.
Thank you. I need, just want a point of clarification. They took 45 out of the IPTIP fund for the vehicle?
Correct.
Okay. Now, the IPTIP funding is the funding for the building, so are we going to put in buildings and others, or what is the purpose with the, because I just thought it was always buildings, and that they allow you to get, a vehicle through, I guess, the other funding, or would that be budgeted?
Last year, I want to say in October, this committee okayed us to spend $100,000 out of IPTIP to buy vehicles. So it just took that long to find a vehicle because the production of vehicles has been very low. So we found a vehicle, luckily, 2 months ago, and was able to purchase that out of the okay from the IPTIP funds that we were okayed for.
All right, and then the money that you're putting back in is just something that was raised?
It's excess revenue over expenditures is what it is.
Okay, they're going back into the IPTIP
It will go
fund.
back into IPTIP, correct.
Mr. Wheeler?
Don't forget about the land sale. That's where the big chunk of the money going back into IPTIP came from.
Right.
Because it was paid for out of IPTIP.
Yeah,
The land sale south of town,
Yes.
that went back into IPTIP. So the money went out, but money came back in, 145?
Something like that, yeah, 152, something like that.
Yeah.
The purchase was, I want to say, for $85,000 in, I don't know what year it was, and then they sold it for $152,000 or something like that. That's what we received back, was $152,000. So some of that money was, I mean, either way you purchased it or put it in there, IPTIP purchased the vehicle.
So does the 448 include the 152?
Yes, it did.
It does?
Yes.
Oh, that's why it got the 100 and some more thousand.
Yes.
So the other thing I'm seeing nicely here under stray animal disposition, animals adopted, because 62 is a really nice number to have as an adoption, especially 56 cats or 55 cats.
Yes. So 54 of those cats went to a rescue. That includes the 25 cats that we took from a house in Moments when the village called us to take those cats. So 25 of those cats went to the village of, we're from Village of Moments, and they went to rescues. We put out a plea as soon as we heard that we were taking in all these cats. Rescues came down within the week and took all the cats from us, which was a great help to us because the way our facility is equipped is we have so much room in a garage and the rest of the cats are housed above dogs, which isn't ideal for anybody. However, these cats live with dogs, and that we knew they were only staying there for a short time. That's where the cats went for the short time, and then they were taken to rescue. Some cats do get housed above dogs because of overflow. They work out fine, everybody's fine, but it's not ideal.
No, maybe the cats is okay with the cats and it's not always okay with the dogs.
Right, exactly.
So, and then and when you say they go to rescue, that means that usually they are adopted then. Is that what that means usually?
So we deem them adoptable, and then they're put out to rescue, so then they get spayed or neutered, and then the rescue puts them up for adoption. Which I've heard that they were all successfully adopted. So
You couldn't give a better report than that. That's a great report. So, anything else? If not, if there's are not any others on this page, we want to turn to the specific statistical data page because it says the same thing, only a little larger.
breakdown.
So, surrendered by owner, those 24 cats are the ones you
Yes.
were talking about. So that's the 24, and yet you had 33 stray adult dogs, and where are they? Where would you say stray dogs are?
they're from all over the county.
All over the county.
Correct.
And you are able to go countywide to get, because someone calls you and said there's a dog roaming around a neighborhood?
So if you live in a jurisdiction where the county sheriff's department is your primary police, we can go to that residence. If you live in a city or a village that they have their own police department, then we have to have permission unless we have a contract with them. So I have sent a contract to Sun River Terrace, and I have sent a contract to Aroma Park for those to possibly have contracts with them. So I've not heard back from them yet, but those are small municipalities that don't have a lot of animals, but they have, the need for animal control.
For stray, there's a stray need, and you must be getting calls from there, or you wouldn't realize that there's
Actually, the code enforcement officer for Sun River asked about the contract.
Mm-hmm. That's the best way to have that, isn't it? So 45, that's the 45 adult dogs intake, and then even 6 puppies. Did they go along with the dogs, or you didn't have puppies by themselves? Did they come
No,
in?
they just came in randomly.
Oh, not a litter. And the 39 cats and 11 kittens. And 3, are there still raccoons at the wildlife?
That wildlife was a pig.
Oh.
No, I'm sorry, that was a hoofed animal. That wildlife was, oh boy, that may have been a raccoon. That may have been raccoons. I can't remember what they were. The hoofed animal, we did have a hoofed animal, which is a pig. We did have a ferret. We've had a rooster, a couple roosters, a bunny. It gets interesting. It's very interesting. We had a goat in our facility at one time.
People calling saying there's a stray thing, whatever animal, come and get it, and then you go get it that
Yes.
way. So, okay. Then we usually look at the euthanasia, and again, just to point out, in half the cases here, it was the owner elected the euthanasia for one reason or the other. The dog was older, something was going on with it. And in 4 cases, it was one of those many 4 things that are there, either injured.
Yes, usually it's, an injury or behavior. We don't deem them adaptable for certain behaviors that we see in our shelter that we don't want to put out into, the population, which we wouldn't want you to have, or we wouldn't want to have you live next door to an animal that's aggressive towards you or any other animals, something like that.
But then you did not have a rabies, it wasn't really a rabies observation, was it? You didn't have rabies?
So what we do is if an animal bites a human and they are not current on their rabies vaccination, then we have to hold them in our facility or a vet for 10 days. That's what the state has determined for a rabies observation. So they hold them there, and then after the 10 days is up, the owner is supposed to come and claim the animal. If they don't claim the animal, we cannot adopt that dog out because it has bitten a person. So then that's where we have to. So then the owner is charged with abandonment, and then the animal is unfortunately euthanized because we can't adopt out a biting animal. So that's where.
Well, the animal isn't happy either, necessarily. So. Right. Did you have any comment on the proposed amendment or let's see, what was it you were going to have Mr. Conklin help you with?
The TNVR, we have spoken with it about it a couple of times, but we have not had a pure sit-down talk at any point, but we will shortly.
And then there was one where you're going to ask to raise the fees. Is that something?
Yeah, that's on our agenda.
Your agenda too. So there's a couple of legal things that you're working on to help in your work too. So, okay. Do you have any other questions, anyone? Okay, all in favor of the motion, then say aye. Aye. Any opposed, say no. Okay, stay here just a second. We'll see if, Ms. Parker, do you have something to report today?
Just anxious to get back to the table where we could talk to Carrie and Mr. Coughlin about the ordinance that we're proposing. Mrs. Himsa will be at the meeting in December, and I've already talked to her, and so we're going to have a nice little group there to have a good discussion about that. But things are moving along.
Mm-hmm. And Ms. Hemza was really helpful to all of us in a cooperative effort. We, because what did you say, Carrie? Would you say 30,000 cats or 100,000?
I don't even know. She had estimated something like that. It's crazy.
That may need services to help the population.
It'll take a long time.
Yeah.
She's doing great work out where she's at right now. And I just want to say, Carrie, you and your staff are doing a great job
Thank you.
taking care of the animal control, and a lot of compliments I've heard about the way it's being run from people that I've talked to that are animal lovers. So
Yes, and response is the key, isn't it? If someone calls, you need to respond. If you respond, then you're
If we are able to without a jurisdiction, yeah.
Oh,
exactly.
without a jurisdiction. I think Mr. Wheeler mentioned, if last meeting or before, it is, the municipalities are key to all this part of it, to getting cooperative. And you're saying that, we'd like that, but we don't have the facilities. And then we're saying, well, the facilities is, it's all this.
If it gets there,
domino.
then we'll push out more contracts. But the smaller municipalities are trying to do contracts because it helps them, it helps us. It's the larger ones that we have to really look at to see how we can, and it's expensive for the city of Kankakee. It will be a very large contract with them because they do use a lot of our services, so it'll be a very large contract.
I think you've mentioned before, just finally, is that if there is, I'm going to put a blank there, if there is blank in the city of Kankakee, you can bring services to them. Is it a biting dog? What is it?
Yeah, we always go out for rabies control. So if there's bats or dogs that has bit a human, it costs the village nothing. That is our job by state statute. We have to go for rabies control and for just bats and dogs that bite
Or
human.
raccoons or anything else
Right.
that's doing it. So that it doesn't mean that you never can go into Kankakee. It just means there are certain circumstances and permissions and all.
So if it's a dog on dog, we have to have permission. But if it is a dog versus a human, that's our job. We have to go into the
Protecting the
village,
public.
in the city.
Okay.
Chairman, I just have one other thing, if you don't mind.
Sure, please.
Okay, it's just a reminder to everyone, the weather's getting very cold outside, and worried about those feral cats or whatever animal might be roaming in your area, to please, it's very simple. You can go on YouTube to make a small shelter using straw and an old ice chest. If you are feeding cats, a colony of cats, to please make sure that they're sheltered from extreme temperatures, and make sure that they have fresh water that doesn't freeze, because it's really getting cold out there.
And then usually Ms. Parker asks you what you need, so we'll end with that. What could your shelter use that we could volunteer?
We can always use canned cat food and canned dog food, Kongs, things like that. Just some kind of puzzles to keep the dogs interested when they're there. It's getting colder out, not to spend as much time outside because it is so cold. We want to keep them indoors. It's hard on them, but keep their minds busy and them active. Puzzles, Kongs, peanut butter, something like that.
And if hopefully everybody knows where you were located, but
we are at 1270 Stanford Drive in Kankakee, over by Acme.
Over by Acme, and we can bring it there, or
the sheriff's department. Even I will pick it up from there. I'm there every Wednesday.
Oh, so if we brought it to the sheriff's office,
Absolutely.
we could do that
they'll be fine with it.
every Wednesday. Yeah, they'll be fine.
Yes.
Anything else? Good report. Thank you for sharing, everyone. Okay, let's looking at our agenda. Does someone have a new or an old business item? Mr. Carrico? Just a second. Okay.
Thank you, Madam Chairman. I know that what I'm going to share with you, with the committee here today, could be brought up actually to the committee for the criminal justice also, but I see this being an incredible benefits to the community. And since that we've been talking a lot about, and there's been a lot of talk about drug prevention and drug abuse, I wanted to say that we have an incredible optional asset to the community. As long as we can have the Springfield and some of the legislators to support that idea of having a proposal for a new license on the state. This license is on the neighbor state, Indiana, and that is called the acupuncture detoxification technician or specialist. The detox, acu-detox specialist. And what that is it will be specific people, could be a healthcare professional, could be social workers, even family members can have a short training on how to do this protocol. Is only allowed to be done on the ear, so it's not a full body acupuncture because we have a license for acupuncturists in the state of Illinois. So this specific license only allowed the individual to work with the specific points on a year itself, and that is for drug prevention and rehab in general. It could be from a mild beginning of addiction to a hardcore addiction. It can be for trauma, stress, and a few other things. So I feel kind of a little bit. I had a conversation with the coroner a few years back, asking him to join forces and get together and see if we can get the legislators to write something and pass this. We haven't got very far yet, but it'll be nice to have the support from other organizations and maybe have Illinois also to join forces together with Indiana and pass something like that. It's a short training. It's not a long-term training, and individuals can be licensed after it's passed. And that will be a great asset to the community and for drug rehab and prevention.
And what does the puncture do? What is that to do?
Those are acupuncture points. They are generally used for over 3,000 years already in China. And those points are used for the decrease of the urge of drugs.
So it doesn't help
abuse
detox or anything. It's prevention of. It's prevention.
Well, it helps in general because it stops the craving. Yeah.
Preventive maintenance.
Right. It's generally sponsored by the National Acupuncture Detoxification Association, which is nationally recognized here and in Canada, and the training is supported by that organization.
Ms. Ryan, do you have a question?
Yeah, what are the success rates?
Oh, she wants to know what the success rates are.
The success rate is very, very high. As a matter of fact, this organization has been around for quite a long time, and they've been training people all over here and Canada. And a lot of drug court programs actually utilize those technicians. No, not ours, because the state of Illinois doesn't.
Yeah, we do. We do. Acupuncture is part of the
yeah. No, I'm not talking about a full body acupuncture. I'm talking about the acupuncture detox technicians. They're specialized only for the year. I'm not talking about the acupuncturists.
Right, so what? Do you want to clarify?
No, just the SAMHSA grant. I know we've contracted with acupuncturists, yoga, things like that, to get people to focus on their sobriety rather than, as he's talking about, it's a different type of acupuncture that is currently not licensed, I guess is what you were saying.
Well, the acupuncture technicians, the specialists are not licensed in the state of Illinois. They don't have a license for the state of Illinois. Other states have, quite a few states. The difference between those two is the acupuncturists, they can do in general full body acupuncture anywhere on the body. The acupuncture specialists, the technicians, they can only specialize on non-specific 5 points on the ear itself. So they cannot do a full body thing. They cannot just insert needles all over the place. They don't have to do just needles. They have a little seeds, a little beads that don't bypass the skin that can be put on those points to come up to the same results. The advantage is that you can multiply the number of practitioners because it's short training. Instead, acupuncturists will have to go to school for 2 years previously and 3 years in acupuncture. So it's total 5 years. With this one, it's a short training.
And your message today is that you're trying to encourage the licensure approval.
I was trying to encourage not only the legislators, but also the other organizations that are involved with drug prevention to stop pushing a little bit and see if it can have this being done in the state of Illinois, since other states such as Indiana and other states already have a license for those individuals. Why not us? Why don't we have more practitioners working in that area?
Because in answer to your question, the success rate seems fine.
Yes.
Okay, well, lots of good news today then.
Thank you.
Anything else? Mr. Kirkstra, would you like to move something?
Madam Chairman, I would like, or Chairwoman, excuse me, I would like to make a motion that we close.
Ms. Peters, will second. All in favor say aye.
Aye.
Any opposed, say no.